watching UBC TV. Thank you for still staying with us till the hour of 10 o'clock. My name is Sophia Matovu, and I'm going to be taking you through this special edition of a talk show. I know it has been a demand. Many of you have been approaching us and telling us, but you're not talking about this area. It seems like you're pushing stuff under the carpet. Today, we are here to talk about the topic as you are seeing it. Pathways to parenthood, fertility donor programs are going to be explained to you. But first, let me read for you these facts. Globally, about 1 in 6 individuals or couples worldwide face challenges with fertility. That is according to WHO. Then, around 12% to 15% of couples are unable to conceive after 1 year of trying to get pregnant without using contraception. This is according to the National Institute of Child Health and Human Development. Another fact is, for healthy couples, 40 to 60% of those under 30 years will conceive within the first 3 months of trying. Within the first 3 months of trying. However, for couples who have been trying for more than 3 years without success, the likelihood of getting pregnant naturally within the next year is 1 in 4 or less. And that is according to NHBS UK. So these are facts and issues that are being raised, not by me, but they are facts that are founded. Now, today with me in studio are experts to share on the topic, like I said, pathways to parenthood, fertility donor programs explained. With me here on set is none other than Dr. Judith Aichirize, who is a gynecologist and she's a fertility expert. How are you, doctor? Good morning.
Good morning, Madam Sophie.
Okay. And then we shall also have Dr. Moses Batwala, who is the medical director and founder of Fiona Fertility, and he is going to be participating on Zoom all the way from Dubai. Doctor, good morning.
Good morning, Sophie. Thank you very much for having me.
Okay, most welcome. Now, I would like to start with the first question, because when we're talking about fertility donor programs, somebody might not be able to understand what exactly we're talking about. What are fertility donor programs? So let me start with you, who is seated here right with me, and then doctor can take it up from there.
Good morning, viewers. Basically, when we talk about donor programs, we talk about fertility treatments which involve a person or a couple using gametes which are not theirs. That means from someone else. By gametes, I mean sperms and eggs. Basically, that's how I can explain it.
Dr. Moses, and then of course, you know, there are certain times, I mean, with technology and everything that is coming out, why do we opt to use this assistive? Would I be right if I said assistive? Or why would we go to use somebody's gametes or sexual reproductive cells as opposed to using those for the very individuals concerned?
Sophie, thank you again for hosting me. There are a number of different reasons why someone might opt to have to use donor gametes, and that is like donor sperm or donor eggs. The first one, if I would start with why would couples opt to use donor sperm? Firstly, there are men who might have a genetic illness, which if they conceived using their own sperm may be transmitted to their children. Secondly, there are men who have very low or actually no sperm at all, and this could be caused due to previous injuries, previous medical treatments such as cancer treatment, which required chemotherapy or radiotherapy, which has rendered them unable to produce any more sperm or infertile. And so these would be the reasons why some couples may opt to use donor sperm. And also in this day and age, there are sometimes single women who have been unable to find a suitable partner, and they may opt to use a donor sperm in order to conceive and have a child that they really wanted to start their own family. Then donor eggs. There are a variety of reasons why some couples opt to use donor eggs. Firstly, there may be women who are of advanced age and maybe do not have any good quality eggs or no eggs at all, and some of them have gone through the menopause. Some of them have gone into an early menopause. There are some young women who might have gone through an early menopause, which may be genetic. Again, also like men who have quoted in the past, there may be a medical reason where they have had treatment for cancer in the past and have had chemotherapy or radiotherapy, and this can damage the
Okay, Dr. Moses? Hello, it looks like we're losing out on Dr. Moses. We'll still get back to him. Fiona, you would like, Dr. Judith, you would like to take it up from there?
Yes, in addition to what Dr. Moses has said, patients using donor eggs, they may consider it due to the early menopause that someone has got. Maybe this could be due to a surgery, maybe where the whole reproductive system has been removed due to cancer. Then other reasons, he talked about early menopause, he also talked about the a condition where
genetically your sperms are not, or your...
Yeah, actually some people, you find they haven't had a chance to undergo the normal process of having to go through menstruation and even produce eggs on their own, what we call primary ovarian insufficiency.
Ooh,
yes.
That does happen.
Yes, it does happen, where you do an anti-Mullerian hormone and it's at 0, and you do a pelvic scan and someone doesn't have eggs. So such a person with primary ovarian insufficiency would be a candidate for egg donation assisted reproductive technology.
Okay. Now, when you explain it that way, it's as good enough as saying then this person does not, you know, ovulate or go through their periods if they have a condition like that.
Yes, you will actually, this person will come to us presenting with no period, even at age of 20, 25. So that signals to us that there may be a problem in their genetics and possibly they have never ovulated in their life. Mm-hmm. If you've never ovulated, it is possible that your ovaries have no eggs at all for you to be able to conceive naturally. Mm-hmm. In that you will have, you will need donated eggs to help you assist to conceive.
Okay. Dr. Moses, are you back with us? Now, Dr. Moses, I would like to ask you, because at least from your vast experience, because you're based in Dubai, you're based in the UK, and you're based here in Uganda, how bad is it in those areas where you're practically operating? Because you had me read the statistics at the start of the show, with WHO saying 1 in every 6 individuals. How serious is the magnitude of this problem?
And I want to clarify that there are very many different reasons for couples struggling to get pregnant, and it's not all couples actually require donor eggs or donor sperm. It's actually a minority of couples. I'd say less than 10% of the couples we actually treat actually require donor sperm or donor eggs. There are many other reasons, and which have other treatments for them, which are very successful. And only donor sperm and donor eggs is only in a different extreme.
Mm-hmm. Okay.
So I'd say the main reason why the incidence of infertility is rising around globally, the main reason is that couples are opting to have children later in life. And when I say later, many women are opting to start their families later in life than happened about 20, 30 years ago. The average age of a woman giving birth in about 1975 around the world was about 21 years old. Currently, the average age of women having their first child global, I'm not talking about Uganda specific, I'm talking about globally, is about 31 years old. And there have been many reasons for that change in lifestyle. Mainly, just like men, women want to advance their education. They want to go to tertiary university. They want to do masters, PhDs. They want to have a career. They want to advance up the career ladder. And because of that, they are then opting to start their families later on in life. And unfortunately, one of the things with success of fertility, whether they are trying to conceive naturally or through a fertility treatment, is the age of the woman, because that reflects the quality of the eggs. And because many women are opting to start their families later in life, that means that the quality of eggs have unfortunately decreased, and therefore it makes it just a bit harder to conceive and get pregnant easily.
Oh, wow. That sounds very, very complicated. Now, what are the different type of donor programs, say, that these women can be able to get exposed to, as well as the gentlemen?
Okay. So different types of donor programs. Well, they are, firstly, I'd like to say in Uganda, we don't actually have a regulator, a fertility regulator. Many, the different countries I work in, like in the UK, like in Dubai, actually have a body that regulates fertility treatment. In Uganda, it's current, although thankfully currently there is a fertility bill in front of Parliament, and they're discussing this bill. And I know that the Honorable Dr. Charles Ayume is I think the head of the committee debating this bill. So what is happening in Uganda is actually most clinics are operating under best practice, what they think is the best practice for their patients, and many of them have opted to follow what the UK regulator, or the UK regulator, which is called the HFEA, or the European regulator, which is called the European society. It's called ESHRI, European Society for Human Reproductive Endocrinology, which kind of gives guidance to what is best practice to follow for all fertility treatment. Now, when you ask about the donor programs, most donor programs rely on what is called an altruistic donor, which is people donating sperm or eggs for altruistic reasons, but they may receive compensation for their time. And these are most of the time anonymous. When I say anonymous, the couple receiving the eggs will not know the identity of the person donating them or the sperm. And likewise, the people donating the sperm or donating the eggs do not know the identity of the people who are going to be the recipients and get pregnant and carry the pregnancy, which has used their donor sperm or eggs. Most of the time, all that the recipient, the people who are receiving either the donor sperm or donor eggs will know is non-identifiable information about the donor. They'll know probably in Uganda, their tribe, they'll know their weight, their height, their religion. Sometimes they may ask about the clan of the sperm donor or the egg donor, because people want to avoid using gametes of people from certain clans, which would make it almost incestuous. They'll know the level of education, they'll know the current job, know what languages they speak. So you'll have this non-identifiable information, and that's vast majority of the donor eggs and donor sperm that are used. However, there is also what is known as known donor programs. A known donor program is whereby you actually know the identity of the person whose eggs or sperm you're going to use. I'll give you an example. For example, a female has discovered that she has gone through a premature menopause and she has no more eggs, but she has a younger sister, and she wants a genetic link with her family, because she still wants some kind of genetic link with her. Because when you're using an anonymous, you don't know the identity of the person whose eggs you're using. It's completely anonymous. You don't know their history, and some people, that is very important for them. And so they may bring a younger sister, they may get a cousin, someone with that genetic links, to get those eggs to fertilize them with the sperm of their partner. So those are the two generalized groups of of donor programs that we have, or as I said, the anonymous, where you don't know, you only have non-identifiable information, or the known program where you do have some information about, and most likely the person is related to you, but you are aware of who that person is, and you come together with that person in order to use their gametes and use their sperm or eggs. And once you're in our clinic, we normally do some screening. The screening is, first of all, we screen for transmittable diseases such as HIV, Hep B, Hep C, syphilis, chlamydia, gonorrhea. Those are the transmittable diseases that we normally screen for. And then we also screen for inherited disorders such as sickle cell, thalassemia, cystic fibrosis, to try and make sure that you're receiving healthy both virologically healthy as well as genetically healthy sperm or eggs.
Individuals come to you. What are most of the reasons? Some of them now, for me, I know that possibly for some people it has become lifestyle. It is trendy. I don't want to spoil my body shape. No offense meant. I probably feel I shouldn't be carrying a child, and they'll possibly come to you for that. I don't know, you're the one who interfaces with them. You might want to share some of the reasons as to why they come to you, and you have counseled them or aided them into the process.
Specifically, really, everyone would want to use their eggs, like particularly for eggs and sperms. Every couple would wish to use their eggs. But most of them, from the interaction, they have been forced to that point to take up the decision of using the donor eggs and donor sperms because they have because of the reasons we've already talked about. But for circumstances where you find someone has just walked in and they really want to use donor eggs or donor sperms, it is quite rare, I must say. But maybe the common things we have encountered, maybe someone doesn't want to lose their body shape and they want to opt for surrogacy. That's totally quite a different topic anyway, but it also happens. You may find someone, yes, has had early menopause and they are going to use the donor eggs, but at the same time, they're worried about the body shape. So they will need both the donated eggs and at the same time, a surrogate. So that one becomes quite more complicated. Yes.
Okay, Dr. Moses, are you with us? Sorry, we lost you due to a technical glitch, but I'm back with you. You were still contributing to this wonderful topic. You were still saying, and would also like to hear your take on it. Like she said, at the clinic, the kind of people she's encountered, and for whatever reasons, you were still adding more to it.
Which part do you want me to speak about?
The part you were still speaking about, because we said it's a trend for some of them, especially some of the young ladies, and they feel like, okay, if I'm past the age that we talked about, 21, and I'm maybe like now 35, I feel, I don't want to lose my body shape. I still feel I don't want to carry a child, and I'll opt possibly for surrogacy or some other reason.
Okay. What I'd say is that it's true, there are some people who opt for, I'd call that social surrogacy. So social surrogacy is where there is no clinical or medical reason why a woman cannot carry the pregnancy, but she's opting for it because maybe she's at a stage where carrying a pregnancy may interfere with her career, may interfere with her work, and she doesn't want to do that. She wants to have a baby, but at the same time, continue with her career. You get it especially with people in the entertainment industry, actresses, TV presenters, but that is not the vast majority of the surrogates that the women who ask for surrogacy that we have met at Fiona. We do get social surrogacy, but the vast majority of women who opt for surrogacy are women with medical conditions, such as one, I had a lady who had severe unstable diabetes, and she had a very high BMI, a BMI of over 40. She was very overweight, and her doctors told her that if she did become pregnant, there was a risk to her having unstable diabetes, which would affect her own personal, the risk to her own personal health, but also to the baby. There are also women who have congenital defects such as an inherited heart defect, or even a blood vessel defect. They call them berry aneurysms in the brain, that when they get pregnant, it will raise their blood pressure, and they're at risk of having a stroke, a hemorrhagic stroke during pregnancy. They're also at risk of having heart failure during childbirth. And so for that reason, these women are advised not to get pregnant. There are also women who have had either uterine cancer when they were younger, or even had surgery for fibroids, and they've had their whole heavy periods, and they've had their whole uterus removed. And so physically, they cannot carry a pregnancy at all. And so that makes the vast majority of patients who opt for surrogate.
Okay. Sorry, Dr. Moses, there we lost you. Now there is somebody who says, thanks for the program. Do you pay for the person's time and his blood? This is Reverend Captain David from Buyukwe District. There you go, Dr. Judith.
Thank you very much, Madam Sophie. We don't pay as such. We don't pay for egg donation and sperm donation, but usually we give compensation for your time and loss of earnings during this time. Absolutely, there is compensation for your time.
Okay. Now there we have others who are actually asking for where they can find the clinic service for consultation and guidance. They want the actual location, possibly that you'll be able to tell them a little bit later. Okay. Now we are getting, when we still continue further into this topic of ours, you talked about how donors are screened. Dr. Moses did explain about the screening process. And I would like to ask, just out of curiosity, Dr. Moses, that's if you're with us, how do you identify these people who would like to go through the process? Do they approach you, or do you call out for some of them and you're like, if you would like to be part of the donor program, please come through because somebody will need your assistance? Because I've seen that as well, because there's one person here who's asked, now this is on a different topic, but this person seems to be very desperate. He's saying, thank you for the show. And he's like, I have a question of help. I need to donate one of my kidney. What can I do? I need money. Now, are those the kind of people who come out to you? How do you identify the donors? And specifically, if somebody comes to you after the whole consultation and you've been able to identify that this is what their problem is and they need the assistance.
Initially, actually, when we first started, Fiona, we started our egg donor program and sperm donor program about 2 years ago. And actually, it was word of mouth that brought our first donors to us. We actually had not really started, but some egg donors came to us and asked and said, oh, I noticed that you have a fertility clinic. Would you be interested in me donating eggs? And I'd say roughly 70% of our egg donors are word of mouth. However, to meet demand, we have occasionally put out WhatsApp messages saying if any to WhatsApp group, if anyone is interested in donating, do feel free to get in touch with us. And that brings us about 30% of the egg donors that we have to date. But vast majority of egg donors, it's word of mouth, which is spreading out. Someone has donated eggs, they tell their friends about it. One or two of their friends comes and approaches us and says, oh, by the way, my friend went through and I would also like to donate eggs. Vast majority of the people who donate eggs are actually university students, or young women and men who are at the start of their career. So that is the vast majority of the people who we actually see donating their sperm or eggs.
Okay. Now, I'd like to get to Dr. Judith here with me in studio. When Dr. Moses has clearly explained about the whole donation process, do they donate them for a fee or it's for free? Because, you know, you've had the scenario of one who wants to donate the kidney because he says he needs the money.
So I would encourage, if anyone wants to donate the eggs or sperms, just like any other organ, it should be free, out of goodwill, out of wanting to help that person who can't conceive naturally. But in addition to being of goodwill, we give you the compensation. It should not be the whole motive of you donating the gametes. It should come out of your heart, say that you freely give out. Because this compensation varies from one clinic to another. So if it's for the monetary benefit, someone will get devastated, they will not feel happy. Of course, for every procedure, for everything that is done, there may be moments where you feel this is too much for me. So if it wasn't out of goodwill, you may feel pressured to do so. But if it is out of goodwill and the money compensation comes in as an additional benefit, you won't feel overwhelmed. Because I must say it's an emotional journey, someone donating their eggs to someone they don't know. So I would encourage really someone to come out of goodwill and not attach any monetary benefit.
Based on what Dr. Moses said, he talked about the age bracket that's prone and is really like participating in this kind of donor programs, fertility donor programs. Do you counsel some of these people when they come out to donate the eggs? Do you really tell them about the repercussions and all this, or for them it's just like, or you've even had possibly scenarios of some telling you, I'm donating the eggs for you to keep them for me when I'll need them in future?
So when these donors come to us, maybe they have come in by word of mouth, or maybe a friend had donated and now they have referred to us. When they come, we take them through a consultation where we take their medical history and understand how their lifestyle has been. And then we go through a series of testing to ensure that they are fit to donate the eggs. Then at some point, we have what we call counseling for them. We get for them a counselor who talks to them how like to deal with the emotional bit of it. Whether they wish to donate the eggs and they also want to use, it's also acceptable actually. They can decide to donate and they can use the eggs at some point in their life as well. But we really try to manage the physical and the emotional bit comprehensively.
Okay. Back to you, Dr. Moses. Still would like to talk about the eligibility. Who is eligible to become a donor? Possibly, because you've talked about that age bracket that you have mentioned, but I'm still like a little bit curious, who is eligible? Maybe you might want to spell out that for a person who is watching right now.
Just before I spell that out, and I will, but I also want to really emphasize the point that my colleague, Dr. Judith, has, that one, we do take a medical history from people who want to donate. And that is our first screening, to know, has the person come with good intentions to donate, to make sure they have not been coerced. And then we do provide free of charge counseling from an independent counselor. So the person who counsels these potential donors is they're not an employee of Fiona Clinic. We ask them to see the potential donor and decide whether that donor can continue with our program. And they are completely independent, so whatever their decision is stands. And if they think that someone has joined this program for monetary reasons, they would advise us, and that would end that person's journey with us personally, okay? Because we want to really maintain that this is for altruistic. It is not for you're donating out of the goodness to help other women who are struggling to get pregnant, to help other men who are having difficulty conceiving and having children. That should be the motivating factor. And the reason why we don't want it to be monetary is that there are emotional and psychological issues with donating. You'd feel like maybe there's a child out there who has your DNA, who you may never meet. And so this is why it's really important that we have very clear counseling offered to these, and it can take a 3-4 month period before the actual collection, because we want to really screen our donors very, very carefully. As for the criteria, we do the minimum age for any woman or man who wants to donate their eggs or sperm is 18. So they have to be adults who are able to give consent to donate their eggs or sperm. For the sperm donors, as I said, it's a minimum age of 18, maximum age of 45 years old. So men can donate sperm up to 45 years old. We do a semen analysis, which would check that again it's a good sperm count, because we want to use good healthy sperm, which can be used either for intrauterine insemination, IVF, or ICSI, where we inject the sperm directly into the eggs. And then, as I said, they have to be negative for the blood-borne diseases such as HIV, Hep B, and Hep C, syphilis, gonorrhea, and chlamydia. So we do all that screening, and also they should not have any inherited disorders such as sickle cell or the thalassemias. So that is the sperm donors. We also say that there's a maximum within our clinic. You can only donate to create a maximum of 10 families. So we are not going to use your sperm for, let's say, 15 to 20 families. For us, once you reach the maximum of 10 families, when I say there are 10 different people who have had children using your sperm, we'd stop. That's where we'd stop using your sperm. Or even if we found out that another clinic had used your sperm and had 3 or 4 ladies get pregnant with children, if we have 7, then that is where the maximum is for the sperm.
Okay, now
for the women.
Okay, sorry. Please continue, doctor.
Oh, sorry. For the women, again, the minimum age is 18. However, for the maximum age for women, it is 35. And the reason it's 35 is really to do with the quality of the eggs, because under the age of 35 is what gives us the best quality eggs to use in helping other women get pregnant and have a baby.
Okay. Now, they're asking, how much is the artificial gamete? Is there a gamete for twins? Because most of the times people have come out with either twins, triplets, quadruplets. So that goes to the both of you, but first to you, Dr. Moses.
Okay. So there is no difference in the there's no difference in the price whether you're going to have a single term pregnancy, which is just 1 baby, or 2. It's the only difference is whether we put in 1 or 2 embryos at the time of the embryo transfer. If we put in 1 embryo, you have a roughly 50% chance of becoming pregnant and having a single child. Whereas if we put in 2 embryos, it's a roughly 55% chance you'll get pregnant and a 40% chance that you'll end up with twins. But the process is entirely the same. It's just whether we inject 1 or 2 embryos at the time of transfer. And the transfer is done like when it's similar to when a woman is having a pap smear, which they have every 3 years for screening for cervical cancer.
Okay, now I get to you, Dr. Judith, because it looks like the messages that are coming in a lot on WhatsApp, many of the people are expressing interest in wanting to donate, and maybe that we'll get to share with them a little bit later. Then we had the gentleman come in. This is an anonymous person. They didn't say their name, and he says he's 44 years old and would like to have children, but I think has never had one. How can you advise them?
Now, unlike women, men, their screening is quite easier. The major test we can do for a man who has failed to make a woman pregnant is just as simple as a semen analysis. He can walk to any fertility clinic, provided he has had 3 days of abstinence and he's fit for the semen analysis. He can either come with a partner to help in the process of getting the sample, or usually he can do a masturbated sample. Yes. When
they do the masturbated sample, do you after what period is it valid? Because there are certain times exposure, environment.
It shouldn't be in a latex, so you can't collect it in a condom.
Oh.
It has to be in a container, preferably sterile container, and it should be put in the clinic within 1 hour of collection, and it should be maintained at room or at body temperature during that time. If at all someone has collected it from home, it would be advisable maybe put it in their armpit until they reach the clinic.
Oh, wow. Then Dr. Moses, this comes to you. Hello, good morning. Is there any infertility risks in case one donates? Dr. Moses, that goes to you. Somebody is asking in case there are any infertility risks in case they donate.
I would say there are no risks to that, the donor's fertility. In fact, for women, we have a strict criteria that these are women who have very high fertility. The ones who are chosen for the donor program are women with very high fertility. So they're going to have a lot of eggs. Donating does not decrease the number of eggs you have. We only collect the eggs that would have been available that month. Each month, women are producing anything, the women that who are in the, they're producing anything between 15 to 20 eggs that month, and they would have lost them that month. They ovulate and release one, but about 15 to 20 would have grown that month and then just perished naturally. We take advantage and collect them that month. So there is no risk of your fertility decreasing due to the donation program. Mm-hmm. However, the donation program involves us giving you medication, which makes your more than normally you just one egg grows and ovulates in that month. What we do is we give you an injection that's going to make those 15 to 20 eggs grow. And there is a risk of a syndrome. It's called ovarian hyperstimulation syndrome, whereby your ovaries, which are normally the size of a strawberry, can grow to the size of almost a football if they're too sensitive to the drugs or we use a too high a dose. And so we monitor you very carefully during the egg collection cycle to make sure that the dose we're using, we can manipulate. If the eggs, too many eggs are growing, we decrease the dose. If too few are growing, we increase the dose. But we are very, very careful. We monitor we do regular scans, about 4 to 5 scans during a 10-day period, and we do blood tests to monitor the hormone levels as well throughout this period. And this is all done with safety concerns at the back of our minds.
Oh, wow. So that means for this period, the person is under your care. Now, there is a question. Is it possible to determine the sex of the child one needs? I am 59 years old. This person is commenting all the way from Buyukwe. So he's asking, is it possible to determine the sex of the child he needs or she?
The answer is yes. It is possible. There is something called pre-implantation genetic testing, whereby after we collect eggs and fertilize them with the sperm, we grow the embryos for 5 days in the lab, and then on the fifth day, we're able to take the embryo has about 300, 400 cells. We're able to take a biopsy and take 4 to 6 cells from the cells that would have made the placenta of the embryo. This is all in the lab, and we are able to tell which embryos are chromosomally normal and which ones are abnormal. The abnormal embryos would not have implanted or not have, or if they implanted would have resulted in miscarriage, or even children with syndromes such as the most common being Down syndrome. Mm. But at the same time, we're able to tell the sex of the baby. We'll know whether it's a boy or a girl.
Mm-hmm. Now to you, Dr. Judith, if I want to be a surrogate mother, how can I get into the program? And the other question the person asked is, how much? That is if they want to be a surrogate mother.
Thank you very much. About being a surrogate, starting from the back, about the price. Just like egg donation, someone shouldn't come for surrogacy enticed by money. Mm-hmm. It should be out of goodwill. Just like any other surrogacy, we know it's carrying a pregnancy for someone else. So carrying a pregnancy carries risks. So if you are enticed by money, it may be a complicated journey. But if it's of goodwill, it may be a bit easier. So Usually surrogates, they also come to the clinic usually, and we do a consultation with them also to identify health risks, maybe to carrying a pregnancy. And also they should be between 18 years to 35 years. So when they come for the consultation, we identify any risks and we do testing on their blood, the same things like we do on the egg donors, except maybe for the genetics. But we do an infection screen where we check for HIV, hepatitis B, hepatitis C, the sexually transmitted infections. Yes.
Okay. Now, Dr. Moses, to you. Does using Viagra cause somebody infertility in men? This person didn't say where they are commenting from, but they would like to know, does using Viagra cause secondary infertility among men or in men?
I'd say from my personal and professional opinion, it doesn't. And in fact, we use Viagra to actually help treat men, especially men who have maybe problems achieving an erection or sustaining an erection while trying to conceive naturally. So the answer is no. We do use Viagra in treatment of certain male conditions in infertility.
Mm-hmm. Then this comes to you as well, because I like the way the questions are coming out from the person who is watching right now, because they are as innocent as they are and they are seeking for the knowledge. Now, hello, do you provide a female partner for a man who wants to donate sperm so that they can collect the sample, or it is purely through masturbation?
No, the answer is no. We do not provide a female partner for a man who wants to donate sperm. As far as I know, for the our sperm donation program, the men most of them, I'm sure about 99% of the men produce their sperm via masturbation.
Mm-hmm. They were still having the questions coming in, a lot of them as they keep on coming through. And then this is, this one is asking for your number. Possibly later at the end of the show, we'll be able to share them. Now there is somebody who's asked a lot of questions. Because today you can find a woman delivers or produces a monkey or a snake or other animals. What causes such? I don't know from you. I know even the way you're looking, I'm also in shock. You know the traditional stories we've had in that direction. Please, the myths and misconceptions are in every bit. Kindly respond to the person.
Okay. Firstly, I've never heard of any person producing a monkey, snake, or any other animal. I don't think the human body is capable of carrying any other kind of pregnancy apart from a human baby. That I think is we're going into the realms of science fiction when discussing that. And there are very strict ethical rules about what we can do in terms of treatment. And we can only fertilize a female egg with a human female egg with a human sperm. That is the only thing that we can do ethically. These are very, very strict standards, not only in Uganda but internationally. And no self-respecting clinician would partake in any of those kind of things. And I think that is really in the realms of science fiction. It's not something that I've ever come across, or even if I think, do I think it is scientifically possible at this stage in human science.
Okay. Then you have another one asking, good morning, Dr. Moses. If I donate my sperms, where exactly do they go, to the whites or the Ugandans? And if the baby resembles me? There we go. Purely innocent questions, like I told you.
It's a purely, but actually, it's a very good question, because when you're donating altruistically. As I said, vast majority of the people who donate, you're donating to just help, okay? And whereas vast majority of our patients have been actually black recipients, people who have been wanting to. We have had Nigerian couples flying to Uganda to use black donor eggs and sperm. We've had black Caribbeans flying all the way from the Caribbean islands to use black eggs and sperm. We haven't had, the only time we've had white or Caucasian people is for surrogacy. We have not had white Caucasians wanting to use black eggs or black sperm. However, currently, actually, one of my most recent patients is an Arab lady who wants to use a black sperm in order to conceive and have a child. So, but the sperm donors would not know the race of the person who is necessarily they're going to donate their sperm to. We would inform them if a child is conceived, but we wouldn't tell them any kind of information about who the recipient was.
Mm-hmm. Okay, that's good. Now to you, Dr. Judith, yeah? How many families can use a single donor's product, the gametes? How many families?
For both egg donors and sperm donors, the number is the same, and that is a maximum of 10 families.
So how many do you extract from an individual?
So usually we, per cycle, if we do an egg donation cycle, there are many eggs that we collect. Mm-hmm. But for us as a clinic, how we try to limit the numbers, if at all the egg donor has donated and then we have fertilized the eggs with the male partner's sperm, the partner of the recipient couple, when those embryos are formed, they are for that particular couple, not for anyone else. So if it takes an egg donor to come again, maybe 9 more times to make 10 donations, then we can be able to accomplish the 10 families. Maybe in rare circumstances, it can happen that this couple which initially had embryos formed, they decide also to donate the embryos. Then they have to inform, of course, the clinic has to be in the know that these embryos have been donated to someone else. And that one, we shall take it as a second family for this egg donor.
Wow, the donor bit, yes, the embryos, yeah. At what stage
can
one donate an embryo?
The embryos, after 5, okay, when we harvest the eggs, we fertilize them with the sperm. And that fertilization process takes 5 days to form an embryo that can then be stored. So we don't continue to grow the embryo beyond 5 days. We store it at that stage.
Wow.
So it can be donated at any time from when it is stored. Then for the sperm donors, sperms are very many in a single ejaculation. So just a single donation of sperm, we have millions of sperms. Those ones, you can find one donation maybe has helped very many couples. So we shall, as a clinic, we shall take the initiative to know which families have been donated to by this individual. Say that we restrict ourselves to 10 families size.
Okay. Now, doctor, we're going to go a little bit, how should I say, medical? Because now when she talked about the embryo bit, now when this person comes to you and they need the help, what do you determine, or how do you determine whether it's egg or embryo for them?
So embryo is, okay, so first of all, egg. If a woman is in the menopause, she's no longer having periods, automatically she needs an egg, okay? So that is automatically she needs an egg. Or there are some women of advanced age, mainly over maybe 45 years old, where even if they have eggs, the quality of the eggs is decreased, and it's very difficult for us to achieve, not impossible, but very difficult for us to achieve a pregnancy using her own eggs. So in that case, those are the people who would advise, or even women with very low ovarian reserve, very few eggs, even young women with very few eggs. Those are the people who we may advise actually use donor eggs. Then for the sperm, if that lady happens to be single, then she will need a donor sperm as well. But if she has a partner and her partner is able to produce sperm, then she doesn't need the and if you have and if that lady is single and she needs donor eggs and donor sperm, then it's an embryo that she's going to be requiring, both because it's both donated eggs and donated sperm to make an embryo, which is then given to her because she does not have any genetic contribution to that embryo.
I'd like you to explain that again break it down again for the layperson, because I see eyebrows raising in some corners where I'm seated and they're like,
Okay, I'll repeat it again. So the question is when would we advise either using donor eggs or donor sperm?
Embryo.
So firstly, also, if we cannot use a woman's eggs, she automatically needs donor eggs. And that could be because she has gone into the menopause, or the quality of her eggs is low. So for any of those, if she has gone through the menopause and has no eggs, or the quality of her eggs is very low, or maybe she has had previous cancer treatment with chemotherapy and radiotherapy, she needs donor eggs. That is what she's going to need. Okay. Now, if she does not have a source of sperm, for example, someone comes to us and says, oh, by the way, I'm in the menopause and I'm single, but I want to have a child. She needs donor sperm as well, because giving her eggs is of no use because she needs them to be fertilized. And therefore, donor eggs and donor sperm form an embryo. And so that lady is eligible to use a donor embryo because she doesn't have a source of eggs or sperm. She needs both of them. And both of them summates to her requiring a donor embryo in order for her to get pregnant.
Okay, thank you.
Or even she may be in the menopause, but also her male partner may be having a condition where he can't produce any sperm as well. So again, that couple may require donor sperm because the man can't produce sperm, the woman can't produce eggs. Therefore, we're going to use donor eggs and donor sperm to create a donor embryo, which we can then provide to them.
Okay, that's great. Now to you, Dr. Judith. My wife has blocked fallopian tubes. She stopped periods 3 years back and she used donor eggs in order to get pregnant.
She didn't put the age.
They didn't put the age.
Okay. Yes, I must say they can get pregnant using the donor eggs. But in that condition where you have blocked tubes, most probably if both sides are blocked, you can't conceive naturally even though she was having periods. So in that case, she has two issues. Not having periods, most likely the ovarian reserve has reduced. So she needs donor eggs. Then blocked tubes means she can't conceive naturally. Yes, so meaning the best way she can get pregnant is using the donor eggs and undergoes an IVF cycle. And then she can have a baby.
Okay. Now, Dr. Moses, there's somebody asking, do you operate in Dubai only? I'll not be the one to respond to that for you because you have a person who is concerned and is asking. Then this one is Opio from Bukwe. Please, how long will it take for a sperm donated to expire? And if it expires, what is the risk to the recipient?
Okay. So I don't know which question do you want me to answer first?
You will answer the other one later towards the end of the show on where you're best, because people just feel I've got a lot of concerns or WhatsApp numbers where they're like, where can we find Dr. Moses? Let him share his WhatsApp line with us and a lot ABCD. But now this is Opio from Buyukwe. Please, how long will it take for a sperm donated to expire? And if it expires, what is the risk to the recipient?
So, one, we can actually store donor eggs and donor sperm for up to 55 years. We can have them safely stored and they won't expire for up to 55 years. It's not necessarily that we keep donor eggs or donor sperm up to 55 years, but roughly every 10 years, every year, we try and contact the donors and say, are you happy for us to keep your eggs in storage? Because being a donor does not mean once you have donated, you cannot rescind your donation and say, I no longer want my sperm to be used. Okay, so it's not that they expire, but if that permission to use that donor egg or donor sperm is taken away, then we have to oblige with the wishes of the egg donor or sperm donor, and take the eggs out of storage and let them perish. But scientifically speaking, we can keep donor eggs and donor sperm frozen for up to 55 years.
Wow. Okay, now because I was about to ask, maybe this will come in the legal and the ethical considerations when we do have another show, because there are certain times somebody feels they have donated and then they still feel they have a right. I thought when you give, you give. Maybe you might need to just clarify that little bit here and there.
No, consent can change. When you give something, it doesn't, especially donor eggs or donor sperm, the person who has donated does have rights, and those rights, the only time when those rights end is when that embryo is inside the recipient. And so even the recipient has to be aware that if there's an embryo in storage, which was created by donor eggs or donor sperm, if the donor was ever to rescind their permission, their consent, we cannot use those eggs or those embryos anymore. Okay, and so it's only when that embryo is actually transferred into the recipient that is when the person can no longer take away their permission. But as this is altruistic, it's not. No one has paid for their eggs or sperm. No one has paid for them, and therefore the donor can withdraw that consent at any time.
Mm-hmm. Now this is for you. You have this. This is Dr. Judith. Now there is somebody asking: is it only the blacks who are donating, or even the whites here? And what is the procedure or the criteria in case he wants donor eggs for a white person?
Thank you very much for that question. I'm suspecting maybe it's a white person wanting to donate to us. Mm-hmm. I must say we are not selective about who donates. We welcome both whites and blacks to donate eggs. And virtually, because in Uganda, we don't have the actual standard protocol of what should be screened for egg donors, but as a clinic, we use the UK guidelines to screen all these donors. So I think we meet the criteria of the international standards. So any black, any white donor can really donate their eggs in the same process.
Okay, so at this particular point, it's 11. I'd like us to take a very short commercial break. When we do get back, I see your questions or your concerns are still streaming through. Dr. Moses and Dr. Judith are still here with me, and they'll be in a position to respond to any of your queries or concerns. Where we have this special talk show that has been brought to you to educate you, and it's out of your request. We're talking about the pathways to parenthood. That is Fertility Donor Programs Explained. And with me is Dr. Moses Batwala and Dr. Judith as well, who are still taking us through. That was just a short commercial break. Now to you, Dr. Moses. Sir, we need more educative health. We've been praying for a baby. We are both in advanced age. We got one baby and the baby died. Since then, we have tried to get another baby in vain for 15 years now. Kindly advise. They did not disclose who they are, but this is a couple that is crying out for help.
Thank you for that, Sophia. What I'd really advise this couple is there are many reasons why you can have difficulty getting pregnant, and a full fertility assessment of both the man and the woman is required. What I'd advise is actually, if you can pass on the details to either Judith or myself, we can arrange for them to have a consultation where we can either look over any previous medical history or any investigations that have been done and maybe suggest some further investigations to do, and then we'll be able to advise them on what options they have going forward. But every single case is unique, and we need to do a proper medical evaluation before we can say what course of action is best for this couple.
Okay. Then to you, Dr. Judith, I have spent 6 years without periods, and I was told through, that is an HCG, that both tubes are blocked, and I was told to do particular syndrome, syndrome tests. So my question is, after doing all this listed, can I have my periods back and conceive?
Thank you very much.
I guess you know the tests that they told them to carry out.
Yes.
I will not pronounce them medically. The medical jargon is way too much.
Thank you very much. Still, I would encourage, if someone has had a problem having periods, they would need to contact us, and then we would need to take a thorough history and identify that even before we go for that expensive test, there is the basics we can first do to see their hormonal levels, how they are, and finding out the basics, why they are not menstruating actually, and look at their age and know more about the situation before we could intervene.
Okay. Then, doctor, this is to you. Do you allow a Catholic priest to donate sperm? This is Patrick from Moyo. Or they're from Moyo district, and he's asking if you can allow a Catholic priest to donate sperm. I don't know whether he's a priest himself or he's just asking out of curiosity.
Okay, first I just want to also add on to what Dr. Judith just said with that previous question about blocked tubes. Blocked tubes do not stop periods. So the lack of periods is completely independent from blocked tubes. There are women who have blocked tubes and have regular periods, and the other women with open tubes who don't have any periods. So those are two different factors altogether, and they'll need to investigate, one, the cause of the blocked tubes, and two, which is completely separate, the cause of the absent periods, because those are two completely different things which are not related. Moving on to the question regarding can a Catholic priest donate sperm? Firstly, again, this is if you want to donate sperm, this is a personal choice. It's altruistic. If you want to donate sperm, we do not set a criteria and say certain professions can't. It's if your diocese, if your religion allows you to donate sperm, then we will be happy to use your donated, as long as you fit all the other criteria between the ages of 18 to 45, and you do pass through all our screening of HIV, of all the sexually transmitted diseases, and also the genetic screening, and of course also the counseling. So that is the only criteria we have. Regarding your occupation, we don't have any restrictions. If your occupation allows you to donate to us, we'll be happy to use your sperm.
Okay, then to you still, doctor. My wife has back pain for quite a long time. She has even failed to conceive. Is it the problem? We've been to many hospitals, but the doctor's reports say she's okay. I'm confused. She's 34 years.
It's a difficult question because there are many things that can cause back pain, such as fibroids. There's some women who have very large fibroids and do complain of back pain. If she's 34, she's young, and we would want to find out if she has a good ovarian reserve, find out about the male partner's sperm, because lots of people think that when there's difficulty conceiving, there's a problem with the female partner. But we also need to investigate the male partner and make sure his sperm quality is good as well. And normally, if a couple have been trying actively to conceive for more than 2 years of having unprotected intercourse, then normally at that point, especially at her age, we would then advise that they proceed on to IVF. And given she's 34, most of the time, and that is a young age for us in the fertility circles, the quality of her eggs will be good, and they should be able to conceive using going through IVF.
Okay. Then to you, Dr. Judith. My wife has blocked fallopian tubes. She stopped periods 3 years back. Can she use donor eggs in order to get pregnant?
Thank you very much. Still, in that case, we have 2 issues. The blocked tubes, then also she's not menstruating Not menstruating, we would want to know her ovarian reserve, which anyone emancipating, it could be low. It being low would be a candidate for egg donation. And then having blocked tubes, if both are blocked, we ideally need IVF to have a baby through egg donation. If the AMH shows that the ovarian reserve has totally gone down. Yeah.
Then to you, Dr. Moses, I am watching the program from Nakawa, Kampala. May I kindly know if the person has hernia, am I eligible for the process? I think they would like to donate. I do not know whether they would like to donate. I don't know whether they would like to have a child. But they're asking if they have hernia, are they eligible for the process?
I'm assuming this is a male, a man. As long as if hernia does not necessarily negate your ability to donate sperm. However, we do find that many people with hernias have sometimes have a slightly or moderately decreased sperm count, and so purely on that basis, we would not take their sperm if it doesn't fall within normal parameters. But if it's normal, having a hernia does not exclude someone from being able to become eligible to donate sperm.
Okay, there are certain questions they're asking which are purely like, ooh, you wouldn't even. Okay, now this person says, this is Godfrey from Lira, and he says he's a medical student in a final year. I'm interested in fertility medicine. Is it possible to do it without doing, I don't know what they meant by that, but you know, I don't know why he would be interested in fertility medicine in particular.
I think maybe what his question is he's interested in specializing in fertility medicine,
possibly,
like, to become a doctor like myself and Dr. Judith. What I'd say is that firstly, in order to embark on the pathway that myself and Dr. Judith pursued, the first thing it would be to specialize in obstetrics and gynecology after you graduate. And once you've done that, then it's to associate yourself with one of the institutions in Uganda, and there are quite a number which are involved in fertility care, tertiary fertility care, and you can get on an apprenticeship, and that would help with your training for you to become a fertility specialist. So there are many channels available.
Okay, then is it one is asking here, can a person who has undergone permanent family planning methods be a donor?
Yes, but again, it depends on firstly what age they are, and when they say permanent family planning, the only permanent ones I know are perhaps things like a vasectomy for males, where they cut for the males, if they have had a vasectomy, they can't be an egg donor, because they produce what we call sperm antibodies, which can affect the quality of the sperm. So if you are a male who has had a vasectomy in the past, we can't use you to be a sperm donor. However, for females, if you have had a tubal ligation where your tubes have been cut off, or you're on long-term contraception like the depot, the injectable or the implant, we can use you for egg donation, and we have done so in the past, because that does not affect the quality of your exosperm. As long as you're under the age of 35 and you have a good ovarian reserve, which we do with a blood, which you can measure with a blood test, women who have undergone permanent contraception, and that is like tubal ligation, or they have long-term injectable or implant contraception, you could still be eligible to be an egg donor.
Now, Dr. Moses, it looks like you're that more in the hot seat. Now, will I remain anonymous, or can the child's parents contact me in the future in case they have donated sperm? Then he goes ahead to ask, what are the chances a child a child could find me later through DNA testing, like after a number of years?
Okay, so firstly, there are a number of things here. We, at Fiona Clinic, we are operating under the anonymous scheme, whereby someone would not be able to, if you donate anonymously, no one would be able to contact you, in the future to say, oh, by the way, you use your sperm, and I am the progeny, I am the child who was conceived. There'll be no one to give them that information. And that is the voluntary code that we are following. However, there is a bill being discussed in front of Parliament, and we don't yet know what the outcome of that bill is. Because in the UK where I operate, when children get to the age of 18 and they find out that they were conceived using donor sperm or donor eggs, they do have the right to go to the clinic or even the government and ask for identifiable information, as in the name, address, a last known address, or contact details of the donor. That is the law in the UK. We don't yet know what the law in Uganda will be. Will it be following the UK where a child wants, and when I say that it's the child only, it's not the people who received the donor eggs or sperm. It is only if the child wishes to know who was the person who donated that sperm or egg. I want to have information about them. However, as I'm saying, I am completely in the dark as to what the final appearance of the reproductive bill will be in front of the, which is actually going to be debated in the Uganda Parliament, and that will give us more guidance as to what the law will be going forward. And we're expecting it to come out in the new Parliament after elections in January next year. After that, we will have some better insight as to what the law will be that will govern Uganda, because at the moment it's a voluntary code and we are opting to follow what the UK guidance is. However, once a bill comes forward in Uganda and Uganda has a definitive law, that is when we shall know what the law is going forward.
Okay. Now to you, Dr. Judith. Is there any infertility risks in case one donates? Secondly, if I would like to donate, how do I start? I am 22 years old. This is a girl who says she's 22 years old. I know it has been said over and over, but possibly she's just joined the show and would like to know. And please do respond, because there are many who are saying they are willing to donate eggs. How can they help? Those are the majority that are coming through.
So, thank you for that question. When you donate eggs, it only affects that cycle, that is 1 month of a menstrual cycle. So it won't affect you having children in the future. You will remain fertile the way you were, and you can have your children the time when you wish to. Then if you wish to be an egg donor, you can come to Fiona Fertility Clinic, and then we can take you through the whole process. When you come after the first consultation, usually we give you a patient information leaflet, which has all the details that you need to know, what you should expect in the journey. And then we give you some time to first think about it after you've read through. And then when you've made up the mind, you can come and we do a thorough investigation, which involves doing blood tests to screen you for HIV, hepatitis B, hepatitis C, and the sexually transmitted infections. It is a step-by-step process. So when those ones are very okay, including actually your ovarian reserve, we do a scan to check your pelvic organs if they are all okay. If all those tests have been passed, you go to the next level, which is checking for genetics, looking out for sickle cell, looking out for any genetics that would be passed on to a child born from your eggs. So I must say it's a comprehensive pathway. The details can be discussed when someone is at a clinic.
Okay. I have blocked fallopian tubes and I've tried to unblock them 3 times at different hospitals, but I have still failed to conceive. How can she be helped?
Okay, thank you very much. Usually, there are many causes of infertility, and the major one in Uganda is blocked tubes. Blocked tubes, if you've tried several times and they haven't unblocked, sometimes there is a risk that even though they partially unblock, you may conceive and you end up with an ectopic pregnancy. That is a pregnancy in the fallopian tube. Because having blocked tubes in your past sometimes affects the quality of the fallopian tubes. So the best mode of conception in such an individual, it would be IVF. IVF, I'm not saying this person specifically needs donated eggs. They can use their own eggs, their partner's sperms, but conceive naturally. It will also depend on the age and their ovarian reserve, largely, and then the partner's semen analysis. Yes.
Okay. Now there is this one. We're saying my sister is pregnant, but she keeps giving off a bloodish. It's a discharge. That's what they meant. What could be the problem? I think, I don't know, is the sister attending antenatal? Maybe
yeah.
you could add a little bit more to that to allay her fears. My bit to her will not be valid.
Yeah, bleeding in pregnancy, I must say, it's not something you can take light. It's something that puts your pregnancy at risk. It depends on which stage you're bleeding at. Towards the end, it may be okay. But at the beginning, it may not be okay. Midway, it may not be okay. So still the question comes back, like you've said, is this person attending antenatal? If not yet, I would encourage the person to start attending antenatal, and then we could find out why they are having the bleeding. Some of the causes of bleeding in pregnancy, like in early pregnancy, your pregnancy may be at risk of going through a miscarriage. So it is preventable if found out early, and some women, in maybe less than 3 months, they may require some hormonal supplement to keep the pregnancy going. But midway, sometimes the major causes of bleeding could be abnormal placentation. The placenta being a bit low-lying, closer to the cervix, in that even sexual intercourse can trigger bleeding. Maybe moving on a border may trigger bleeding. So it's quite a lot. It depends on where this person is in the pregnancy and would require medical attention.
Okay. So you've heard it from the doctor, because I know if I had said the same and asked them to attend their antenatal clinic for that to be resolved, you might say, is she a medical person? Why is she telling us? Thank you so much, Dr. Judith. Now, to you, Dr. Moses, the question is, what is the reason for limiting the male donation to 45 years, yet the male can still produce even after 70 years?
The reason why it's limited to 45 years old is that there are some other, I'd call them, we think they have a genetic component which can cause problems in the children. There's a higher frequency of certain neurological conditions in children born from men who are over the age of 45. The main one is autism. And we notice that autism increases as the male partner gets older, despite the female partner, and is independent from the female partner's age. So under the age of 45, I think the incidence of autism is about 1 in every 45,000, whereas over the age of 45, it's 1 in 10,000. So because of this, we opt to have that cutoff of the age of 45 to use a sperm donor.
Okay, then to you still, this is a person from Obendere. My ovaries measure 1.5 and 2.2. I have failed to conceive and my periods are lost. Any advice?
Again, it's about from the sizes she's mentioned of the ovaries. Those seem to be normal sized ovaries. So I wouldn't say that they're overly small or anything. They're well within the normal parameters. But again, it's investigation, a proper investigation, investigating the male partner, checking that his sperm count is normal, investigating the female partner, are her tubes open, does she have regular periods, how old is she, what's her ovarian reserve. Once we have those, once we have also the frequency of intercourse, for couples who are trying to get pregnant, we advise they have intercourse at least 3 to 4 times a week, unprotected intercourse, and try for at least a minimum of 12 months before seeking advice. So based on this, we'd have to do a full assessment before we can advise them whether there is a problem after reviewing their results.
Okay. Now, I know you spoke to this a lot earlier in terms of the screenings you do for the donors and HIV positive, whether somebody is HIV positive, you check for HIV. But here we have one. Please, I would like you to respond to it again, much as you've spoken to it. I'm Rita from Ginger, and I am HIV positive, but my husband and children are negative. Can I be able to donate, please?
Unfortunately, as our current protocol is, unfortunately, people who are positive for HIV, hepatitis B, hepatitis C, and other genetic illnesses can unfortunately not donate in the current program. Now, saying that, I know that in the UK currently rules are changing as to whether people who are HIV positive can donate, and that is based on whether if they have an undetectable viral load and are on stable antivirals. We have not yet adopted this. However, in our spirit of inclusivity for everyone, we may look at it. But at the moment, we don't accept donors who are HIV positive. But let us see what goes, especially with the legislation that will take place next year, before we can make a decision as to whether we can accept people who are HIV, hepatitis, and hepatitis B, hepatitis C, or even other communicable diseases can become eligible for the donation program.
Okay, and then to you, Dr. Judith. This is Charity from Lira. She says she has hormonal imbalance, and so does the sister. Yeah, I have not conceived. Could it be because of the hormonal imbalance? If so, is it genetic, and how can she be able to manage, or what treatment can she use for the hormonal imbalance?
Thank you for that question. Someone may say they have hormonal imbalance, and it's the one they think could have stopped them from conceiving, but infertility may be caused by many things. So in that case, we'd need a comprehensive checkup on this person, taking into account of the history, how often they menstruate, are they missing the periods, because would say it's hormonal imbalance. Maybe if they are missing periods, taking like maybe 4 months without having a period, then they resume. All else would want to understand whether the periods are heavier or they take a longer time. Yeah, would really need further evaluation of the situation about that.
And there is this one who goes specifically, Dr. Moses, what does this sharp piercing pain I feel in the testicles mean? This is a gentleman who is a little bit worried. I do not know, we have this tendency of taking certain things lightly. If you've been feeling the pain for quite a while, why haven't you gone to consult a doctor? And I don't know, you don't need to wait, because I wouldn't take it lightly if I was the one. So Dr. Moses, to you.
Yeah, I would say that definitely I would also thoroughly agree with your point. If you are a man and you're experiencing pain in your testicles, go and see your doctor as soon as possible. It could be your family doctor to begin with, a general practitioner, and they can then refer you on to a urologist to investigate this, because there could be many different reasons why you're having scrotal or testicular pain, and they should be investigated, because it could have nothing to do with fertility. It could be a swollen blood vessels, what we call what they call them, hydrocele in the test. It could be an infection. It could be God forbid a tumor. So I would advise, first point of call, go and see your family doctor or a general practitioner, and they'll refer you on for further investigation. And if that is all normal, then we can also assess your fertility and see if there's anything we need to do to help you.
Okay, and then there is this person from Gulu, still for you. My husband has no sperm cells, and she's asking for help. How can they be helped?
Having no, I'm assuming that they mean that he went and did a sperm count and they found no. That does not necessarily mean there is no sperm. And in fact, we do have couples where the man is not producing. So there may be very many reasons why a man does not produce the sperm. Or we call them either pre-testicular, testicular, or post-testicular failure. Post-testicular failure is where there is a blockage. That blockage could have been caused either genetically, or it could have been caused due to an infection or an injury. And sometimes there can be surgery done to unblock the blockage, or we simply just go into the testes and collect sperm from there. Testicular failure could be due to a variety of reasons, including genetic. It could be due to medical illnesses, sometimes stabilizing that medical condition, such as, let's say, for example, diabetes or high blood pressure, or even changing the medication you're on can help you start producing sperm. And then the pre-testicular failure could be because of a hormone imbalance. Yes, there are men who have hormonal imbalances, and therefore treating those hormonal imbalances by giving them sometimes injections of hormones such as FSH or even Clomid, which is even used by women to try and ovulate, can make the men start producing sperm. So there are different reasons why a man can have is not producing sperm. They can be investigated, and in almost 60 to 70% of the time, we are able to get sperm from the individual, which can be used to help them conceive using his own sperm. So there are a variety of reasons. Get in touch with ourselves or with a specialist around you, and he'll be able to investigate and give you your options.
Okay, and then there is someone who is saying, thank you, Dr. Moses and Dr. Judith, for this educative program and fertility services that you are rendering to Ugandans. I've been studying scientific literature on endometriosis, I think, for the last 2 years. I am seriously urging parents that have a duty to identify daughters who have periods, heavy periods, or extremely painful periods to seek treatment as early as possible. Resolving these issues early is critical to prevent further complications like infertility, miscarriages, and ectopic pregnancies. I don't know if that is what it is. You might want to speak to it.
So I think the condition she's describing, he or she is describing, is called endometriosis. And endometriosis is quite common. I think it estimates it is that it can affect maybe up to 20% of all women. There are some women who have endometriosis, but their fertility is not affected. They're able to conceive naturally and get pregnant. But we also know that there's a significant proportion of women who have endometriosis who have difficulty getting pregnant, or even when the endometriosis is very aggressive, it can affect the ovarian reserve because it can destroy ovarian tissue, and therefore they run out of their eggs even early. And also they have even difficulty conceiving naturally because they have chronic pelvic pain, which is even made worse when they try and have intercourse. It's called dyspareunia, where they find intercourse extremely painful that they avoid it. So there are a number of treatments available for endometriosis. It could be simple pain relief, or B, hormonal treatment. Unfortunately, most of the hormonal treatment would prevent you getting pregnant. So the hormonal treatment is to be used if you're not actively trying to get pregnant. And lastly, surgery. Uganda is now developing a lot of laparoscopic surgery, keyhole surgery, and the surgeons are able to do operations on endometriosis, day surgery, where you're able to leave the same day, where they're able to diathermy or burn away the endometriosis in the woman's pelvis, and that can provide pain relief or even assist them get pregnant if they're trying to get pregnant.
Okay. Then this gentleman is asking, he donated at the age of 24. Right now he's 29. Can he still donate? If he did it when he was 24, now 29.
And the answer is yes, as long as he would still need to repeat the virology screens, HIV, Hep B, and Hep C, and also would need to find out if he has reached the threshold of 10 families. If he has reached the threshold of creating more up to 10 families, we wouldn't be able. But if he hasn't, then yes, he would be eligible to donate more sperm.
Okay. Many of the ladies who are really participating, or the people who are participating, you'll see that many are speaking to the issue of like losing periods. I skip my periods for 4 or 5 months, will I be able to conceive? Then you have a category of those who are talking about their age bracket and have had issues and have failed to conceive for quite a number of years. That also includes some men who are concerned, I am 54, can I still conceive? I'd like you to speak to that, and as well, Dr. Judith will also add more to that, because it looks like it's a problem we're getting to notice based on the messages that are coming through. Now here you have another one who is 45 years old, and she says she has fibroids that have been reoccurring after surgery. However, my periods are very regular, though with heavy clots, and I have failed to conceive. We have tried to go for IVF, and we are told that after 42, my eggs have disappeared, therefore I need an egg donor. Is that possible?
So, firstly, I'd like to say the main factor, the chief cause of fertility and the main prognostic factors, the success, is the age of the woman. The older a woman gets, the more difficult it is for her to get pregnant. And what we notice is that there's a sharp fall in the ability to get pregnant once a woman goes over the age of 35. The success rate of IVF at the age of 35. The success rate of IVF treatment at the age of 35 is about 50%. That drops to about 20% by the time the woman is the age of 40. That drops to about less than 5% when the woman is 45 years old. So that just gives you an idea of what of the issues facing this lady, especially if she says she's 45. So 45 alone, with everything being normal, would mean that her chances of success are at best 5%. But then add on to that other factors such as fibroids. That makes it more difficult. Her best chance of conceiving would be, yes, using donor eggs. That would, because our donors are under the age of 35, that automatically improves her success rate for less than 5% to more than 50%. But then we'd have to know about the fibroids. Do these fibroids encroach into the cavity? Because if they do, then surgery is needed to, first of all, clear the cavity before we can put in a healthy embryo, and she would have the same chances as any woman under the age of 35 if that is addressed.
Mm-hmm. Then you have this one who is asking you, she's asked me to keep her anonymous. Thank you, Dr. Moses. I have suffered from, what did you call the condition? Endometriosis. I'm just 23 years. Yes. I recently got pregnant but got a miscarriage after a month. And half through, I did another scan and I was told that the thick endometrial lining is now reduced. I fear I might not have a child. Guide me, please.
Okay, there are two different things here. There's the endometriosis, which is normally in the pelvis, and then the endometrial lining, which is not endometriosis. It's completely different. She might have another condition called adenomyosis, which is in the muscle of the uterus. But endometriosis is not in the womb. It's normally on the ovaries and the pelvis. It can even spread to the abdominal cavity. Her success would really be based again on her age, her ovarian reserve, her partner's sperm. There are many ways of addressing endometriosis and treating endometriosis to improve the chances of conceiving with IVF. There are different protocols, such as one called the long protocol, where we downregulate or we shut down a woman's ovaries, because endometriosis thrives on hormones. And so if we shut down the ovaries temporarily, that may help cool down the endometriosis and give us a window to carry out our treatment and transfer the embryo while the endometriosis has been temporarily shut off, and that would help the couple get pregnant and hopefully carry a successful pregnancy.
Oh, okay. And then to you, Dr. Judith. Dr. Judith. This is Janet. I had a 5 weeks and 6 days pregnancy, and I was riding on a bicycle at a long distance. When I reached home, I started feeling back pains, like menstrual pains. There and then I started bleeding. I went to hospital and I was told I had a threatening abortion, which ended up into a miscarriage after 1 week of bleeding. She's curious to know what caused the miscarriage.
Thank you very much. I must say that most miscarriages which happen below 12 weeks, that is below 3 months. And most of the causes of pregnancy loss in those weeks is abnormalities, chromosomal abnormalities in the formation of these babies. Things like maybe being on a border on a rough road, they are aggravating factors, but they may not be the main reason for the pregnancy loss. But when the pregnancy loss happens in like more than 12 weeks, there may be other causes, like maybe an incompetent cervix. Then in later months, maybe the baby has already grown too big and you can have a preterm delivery. Other infections cut across in all trimesters. The first trimester, which is below 12 weeks, then the second trimester, 13 weeks to 27, then third trimester, 28 and above. So infections like malaria, urine infection can cause miscarriage in any trimester.
Okay. Now then there is this one who seems to be asking a question to you, Dr. Moses, but I think it's in line with like if they have for any specific medical reasons. I don't know what kind of transplant they're talking about, but he's from Kasese. This is Maggie from Kasese, and she says she's had a transplant for over 5 years, and it's just, and she's asking, can it affect fertility? She's a little bit worried. So I'm wondering what kind of transplant. She didn't specify the nature of transplant she's had done on her.
I'd say there are two issues there with the transplant, and again, we don't know which organ was transplanted. Most of the time, when sorry
about that.
Most of the time, when women when people have had a transplant, they're given immunosuppressive therapy to prevent their bodies rejecting the transplanted organ. So the first thing we'd need to know is the medication she's taking to suppress her immune system, is it affecting her ability to conceive? Sometimes or even if she was to conceive, could it cause abnormalities in the child as they develop, or even miscarriage? Mm-hmm. So that would need to be discussed, especially with the heart transplant surgeon, to know whether we can put them on to either stop temporarily during and give us a window to do fertility treatment, or even change her to safer, more fertility-friendly immunosuppressive therapy to go on to while we treat them. Mm-hmm. Secondly, with the transplanted organ, if it's a kidney or a heart, does this contraindicate pregnancy? Because pregnancy can make some of these things worse, or even deteriorate the quality of the organ, such as a kid, because pregnancy does put pressure on the kidneys. Pregnancy puts pressure on the heart. So we need to know what organ has been transplanted, what treatment they're on, and what condition it is, because some of them may mean that she cannot carry the pregnancy and may need a surrogate in those cases. So it's quite multifaceted, but if they want, they can get in touch with us, and we'll be able to advise and also liaise with their transplant surgeon as to what course of treatment may be best for them.
Okay. Then I am 48 years old, a mother of 3 children. Can I conceive with the help of IVF by using my own eggs and not a donor?
I would say with her having 3 children, it shows that she has good quality eggs. But again, we need to know how old is she. If she's still young,
48 years.
Oh, 48.
Yeah.
The oldest woman I know, proven case of a woman using her own eggs to conceive and have a child that I know is 47. That is the oldest patient I know. So this patient being 48 would make it extremely difficult, because as I mentioned, even at the age of 45, the chances of conceiving with their own eggs is less than 5%. At the age of 48, it would be less than 1%. I'm not saying it's impossible, but it's very improbable, and I don't know of anyone who has successfully become pregnant using her own eggs with IVF over the age of 47, and that is the only patient that is the oldest patient I know who has successfully conceived using IVF using her own eggs.
Okay, then a quick one: do you egg or sperm bank as well at the clinic?
Yes, we do. We do have a sperm bank and an egg bank where we store unfertilized eggs and also store sperm to be used by our clients.
Okay, then now this comes to you, Dr. Judith. Yeah, his wife has used family planning for 3 years, and after removal, she still failed to conceive again. After the checkup with her, the results say that the system is fine. And what could have caused this? Secondly, they say that she takes the prescribed drugs. Again, if she fails to conceive, I should come for my sperm analysis. Can the family planning insert that she used, could it have caused a bit of a problem? Or does it cause also infertility in men?
On that question, would really be interested in knowing which family planning method this person used. I'm assuming maybe it was the IUD. Or an implant, because they inserted, meaning it wasn't a pill. But what we have to appreciate that different family planning methods can have different side effects. Like some injectable, it can be just a simple injection for like 3 months, but it may delay your fertility for like a year or even 2 years. Oh, wow. Yes, so it depends on which contraceptive method they used. And would also need to understand whether they have had children before. Then, even on the male side, sperm count can reduce over time due to various factors. Like depending on the occupation of the husband, he can have an issue. If at all he's exposed to too much heat, the sperm count can reduce over time, which can affect their fertility. Then also, depending on the woman, the family planning method they used, some family planning methods like IUD may put you at risk of certain infections. And you find you've given birth before, but you develop secondary infertility due to blocked tubes along the way. So for that couple, I would recommend comprehensive assessment for both the male partner and the female partner.
Then they're still asking you, can a man who has done vasectomy be repaired and produce again? The word is repaired.
I think Dr. Moses should answer that.
Dr. Moses, there you go. Can a man who has done a vasectomy be repaired and produce again?
The answer is yes, but it depends on how long previously the vasectomy was. For the highest chance of success of reversal vasectomy, it's within 2 years of the original procedure being done. Beyond 2 years, as time progresses beyond the 2 years, that decreases the chance of success of the reversal. But it can be done. It really depends, and the success rate really depends on how long it was before, from when the original vasectomy procedure was done. Best done within 2 years of the procedure.
Okay. Okay, we just have like 3 minutes to wind up the show. I'd like to ask you, Dr. Moses, maybe I'll start with Dr. here, then I'll come to you, Dr. Moses. What are your parting shots to a person who is watching you right now?
I would encourage everyone who is watching to be conscious of their body and their fertility health. For women above 35 years, fertility reduces above 35 years. So for women above 35 years, if you've been having frequent intercourse with your partner for 6 months and you've not yet achieved a pregnancy, I think you should start to worry. But for younger people below 35 years, that is the female partner, you start to get worried when you've had frequent intercourse with your partner for 12 months, that is a year. So you realize that as you grow older, the fertility reduces. Then fertility doesn't only affect women, it also affects men. So would encourage for people seeking fertility treatment to always attend as a couple, so that we do assessment for both. Because sometimes as the African society blames the woman, They are the ones infertile, but also men can be affected. Thank you.
Okay. Now, finally, from you, Dr. Moses, I know the questions are still streaming in there a lot. We have tried to give you as much time as possible to the person watching, where Dr. Moses blocked off time to be able to participate in the show and address your issues. Possibly there'll be a next time, but please allow him to wrap up the show, because there's so many questions, and possibly he will share with you, or Dr. Judith will share with you, the number of the clinic where you can easily get to them for consultation. But first to you, Dr. Moses.
I would say if there's a parting shot, is like, first, help is out there. There is a lot of help out there, and don't be afraid to ask. If you're a young woman and you just want to know about your fertility, if you're a young man and you just want to know about your, even if you're single, even if you're not trying to conceive, there is no harm in just going to a clinic like ours, Fiona Clinic, and saying, I want to do a test to just check what my fertility is like. And then again, if you are just like, I'd like to echo what Dr. Judith has said. If you're a couple and the female partner is over 35 and you've gone 6 months without trying to get trying to conceive and you've been unsuccessful, do seek medical advice. See your general practitioner, see your gynecologist for full assessment with your partner, so that they can guide you as to where to get proper professional treatment. And if you're under the age of 35, again, and you're struggling after 1 year, do go and see your GP, go and see your gynecologist. There's a helper available, and we'll be more than happy to assess whatever issues there and guide you in the right direction.
Okay. Thank you so much, Dr. Moses. We do really appreciate. We know you blocked off time to be able to participate in the show. We'll catch you next time, because the questions are still so many. Now I'll turn back to Dr. Judith. Kindly share the number so that, you know, people can be able to know how do they get some of these questions still. Doctor, you can still catch them on that number that they're going to share, so they'll be able to address some of your concerns or your issues. Many of you are asking, can I help? What does it take for me to donate? Is the donation for free? Please share the number.
Thank you very much, viewers. So you can contact our Fiona Fertility Clinic on telephone number 077 04 62 432.
Okay.
077 04 62 432.
Okay.
Thank you very much.
Okay, thank you so much to Dr. Judith. I know you had a busy morning, but you were able to block off time to come through in studio. I would like to say thank you so much for everybody who was participating and is still participating. The questions are still quite many, but like I said, Dr. Judith has shared with you the number of the clinic. You can be able to get in touch with them, and you'll have them address many of your concerns. But we'll make time possibly next week to still come back and address some of these issues. Keep watching UBC.